The South African Medical Research Council has seen a spike in COVID-19 fragments at some wastewater treatment plants. Now, samples were collected at 80 sites nationwide in both rural and urban areas. Let's unpack what was found there. We're joined by the Council's Environment and Health Research Unit Director. That's Professor Angela Mathee. Prof, I hope I'm pronouncing your name correctly. A warm welcome to the program. Thanks very much for coming on. I mean, is this particularly worrying, given over the past few months that we've seen relatively low concentrations of fragments of the virus in wastewater?
So the Medical Research Council operates this wastewater treatment program, like you indicated. And what we've seen, especially with the Omicron wave, is that there's a degree of volatility in the concentrations constantly. Mm-hmm. So the results you're referring to was from 2 weeks ago, where we did indeed see quite a worrying spike in the Western Cape, rural areas, and in Cape Town. Mm-hmm. And that's why we issued that statement. And at that time, we were seeing around 1,000 to 2,000 cases being reported by the NICD. When we looked at last week's results, happily that spike had come down. The concentrations were much lower, still a little bit higher than we'd like to see them, but much lower than 2 weeks ago. And at that time, we were also seeing a lower number of cases reported, around 500 or 600 thereabouts. And so we're waiting for the results to come out tomorrow to see what the changes are for this week.
So, Prof, explain it to us lay people. What does this mean if we see an increase in COVID-19 fragments in wastewater?
So it means that there are more cases around, more infections around, and those infections, the beauty of wastewater surveillance is that we can pick up both cases that are symptomatic, people who are having symptoms that they're either treating themselves, or cases that are being seen in the medical system. And they're also picking up those people who have infections but have no symptoms at all. Huh. So when we see an increase in SARS-CoV-2 concentrations in wastewater, it means there is an increase in cases, but some of those cases can be very, very mild, or they asymptomatic, completely asymptomatic.
I mean, that's incredible. In terms of, what we saw in wastewater in those particular areas that you mentioned, the Western Cape, Cape Town and rural areas, when we did see the spike, was that sort of adding up in terms of the reported cases that we were having in that particular week?
Yes, well, I looked at the statistics for cases nationally, and when we were seeing a spike in SARS-CoV-2 fragments in the wastewater 2 weeks ago, there were about up to 2,000 cases per day being reported. Last week, we saw the concentrations in the fragments going down, and the number of cases also went down to about 500 per day. So we'll see what happens tomorrow. On Wednesday afternoon, we usually get the results, which we then distribute to local authorities, the national stakeholders, so that they can make decisions about preventive action. So we're looking forward to what we're seeing tomorrow. What we've learned about the surveillance program over the past year and a half is that where there's smoke, there's not always fire. So we see the concentrations of SARS-CoV-2 fragments are going up and down all the time in all of the more than 80 sites that we're monitoring around the country. And it is a matter of judgment, and we're looking at biostatistical analyses to determine whether it is really going to develop into a peak. So it's a case of constant monitoring.
Right.
Where we think we're seeing something significant, a significant change compared to previous weeks, then we do issue a media statement to inform the public that we're seeing something unusual, but that doesn't necessarily translate into a wave. Sometimes it can be a local outbreak of cases that then diminishes in the following week.
Right.
So it's something that we really just have to keep an eye on all the time and inform the public as soon as we see a change.
I mean, it's incredible that from these fragments you can even tell that the number of people potentially that are asymptomatic, those who are dealing with more serious symptoms of COVID-19. And you've answered it in part already, Prof, but how does this inform the research that the Medical Research Council is doing, as far as this is concerned, with government's response at any given time to COVID-19?
Well, as every week on a Wednesday, we have a meeting of all our various research teams. There are more than 5 in the MRC that contribute or are participating in this initiative. And then we examine the results. We decide, whether it means something, whether it's likely that there's going to be a concern for a particular municipality. And then we distribute that information to all of those municipalities, their cities, their rural areas, and they go to national stakeholders as well. And so at the local level, they get to decide what interventions they want to implement. They have communication systems to their communities, and they may choose to send out an alert, or they may choose to issue a media statement, or they can send their environmental health practitioners to warn people to be careful to adopt the preventative measures that we all know too well. But our job is to look at the data. We collect the samples, we do the laboratory analyses, and then we distribute the information to the municipalities in the main every week on a Wednesday evening.
Yeah, and as we know, this is incredibly important work, given the past couple of years that we've been through here in the country. Prof. Angela Mathee, let me thank you for your time this morning, the Director of Environment and Health Research Units at the South African Medical Research Council.